Thank you, Emperor. Let's cross over to Lincolnshire in London in the United Kingdom, where a consultant obstetrician and gynecologist, who is also the president of the Medical Association of Nigerians across Great Britain, Dr. Ibrahim Bolaji, joins us to tell us how far that country's health system is managing people with ailments other than COVID-19. Good evening, Dr. Bolaji, and thank you for your time this evening.
Good evening, and thank you very much indeed for bringing me to the channels.
Now, how is the UK health system dealing with those who have ailments other than COVID-19? Are they still receiving maximum attention, superior care, and all whatever it is that they were receiving before COVID-19 came along?
As you'll expect, this is not going to happen because prior to the lockdown, all the hospital activities have stopped. But there's going to be a recovery process which started last week. And this recovery process will involve looking at the very minor cases to be operated on. There is no activity in the hospital at the moment. Most of the activities are around COVID. In addition to that, not many patients are quite happy to come to the hospitals. The footfall in the accident and emergency has been dramatically reduced. The elective activities in various parts of the hospitals have been dramatically reduced. All the elective procedures, surgical procedures have been reduced. The only activities that are going on are mainly cases of telephone consultation. But for the antenatal patients, you cannot but see them with a lot of help with the PPE. The situation now currently in the UK, today the death toll has increased to about 34,000. We are now the highest in Europe. The R value 0.7 to 0.1 after 2 days of lockdown. The death toll involves the healthcare professionals has also increased to about 200. And surprisingly, more than 70% of these mortalities involving the healthcare professionals are from the ethnic minority group. This is a bit worrying. We have written to the government about this to look into possible causes of it. For example, if in Nigeria, you're a black man, you have about 4 to 5%, 4 to 5 times the possibility of dying from coronavirus compared to the white minority. The other ethnic minorities involved are the Pakistanis and Asians. For example, Bangladesh hospital fatalities are about twice that of the white. Pakistani hospital fatality is about 2.9, but Black African about 3.7, as high as 3.7 over the white. We're not quite sure what is going on.
I'm sorry to interrupt. Dr. Bolaji, but are people taking, I mean, some of the stats that you're giving are quite startling, but is this in any way affecting the resolve of these various groupings in making themselves available as healthcare professionals, since quite a number of their compatriots are contracting this virus, and the statistics you give indicate that paying the supreme price in some instances?
Yeah. There's been a lot of activities around the place to support one another. We are healthcare professionals. We have an oath to look after our patients. Majority of us, we don't really have a choice. Our first resolve will be to look after the patients. If we don't, who else will? But what we've done as organizations and other BME organizations is to ensure that we push government to ensure that we have protective equipment for all our members. The public inquiry is about to start because the government has been forced to set up a panel, and that panel has been headed by an African, a West Indian professor, Professor Kevin Fenton, but we still don't know precisely what the terms of reference will be, and we don't even know the time scale. But we want that investigation and inquiry to start now because many of our people are dying, and we really need to know why. There's been a number of reasons that have been explained. For example, cultural and genetic factors. Certain Asian populations suffer from metabolic syndrome. And of course, there's a high level of social deprivation. But that is not going to explain the reason why many of the African senior doctors are dying, because they are in the high social class of the society.
Now, allow me to ask that, given the fact, earlier on in your statement, you did mention antenatal visits and the fact that really you're still seeing quite a number of those. Our experience here in Nigeria is that those numbers have dropped by about 50% or more in many instances because, as you pointed out, a lot of people are afraid to show up in the hospital for varying reasons. Are there lessons that, in spite of the imperfections you've mentioned, Nigeria can take from the UK?
Yeah, well, the main important thing is to reduce the footfall. What is responsible for high population of people visiting the antenatal clinic is the number of people that accompany them to the hospital. There is an opportunity for community midwifery to take a chunk of this because you don't really want to bring many people to the hospitals, rightly so. You just want to bring those that are required hospital visitation or the need to see a senior consultant to come to the hospital. Majority of all these cases could be dealt with in the community. And what the communities are doing, they've divided themselves into two groups. Those cases that can be easily dealt with telephone conversation, and those that might require the visit by the community midwife. So they're triaged. And every week, a group of midwives will go around the local community to pay visits. And there are community centers where patients can come to, but a small proportion that come to the hospital, they are spaced out in such a way because the preparation to get ready to examine this patient, you need to put on your PPE. And after you've examined the patient, you have to remove the PPE, clean the environment. And so we are taking 3 times as more time per patient. But you're absolutely correct. The number of footfall has reduced dramatically, and we are only seeing those that require urgent attention.
Dr. Ibrahim Bolaji, thank you so very much for your time today. It's been a pleasure having you on the program. Dr. Bolaji joins us from Lincolnshire, London, in the UK.